Hi, my name is Courtney Melchone. I interned at Specialty Eye Care Group in the summer of 2015, and I'm in the class of 2016. And today we are going to be talking about special ophthalmic testing. We're going to be talking about what that is, what we do at SEG that constitutes special testing, and what we need to do to document that well. So first off, we're going to define special testing, and it is services in which a special evaluation of part of the visual system is made, which go beyond those included under general ophthalmological services, or in which special treatment is given. And so anything that we do within our routine eye exam is not special testing, and anything that we do beyond our routine eye exam does fall into the bucket of special testing. So at SEG, more specifically, these are the procedures that we do that are special tests. And so we're just going to go through each of those. So specular microscopy, anterior segment photography, which would be our slit lamp pictures, and then also meibography. We use that same coding for the anterior segment photography. Visograph, medical retinal pictures, which would be our medical optos. OCT, serial tonometry. Serial tonometry is if we were to keep someone in the office for a day to check their IOP repetitively throughout the day. Visual fields that are extended, so our 24-2, our 30-2, or any other visual fields that are extensive. Corneal topography, gonioscopy, inflammatory, pachymetry, adenoplus, and also our bin. So all of these procedures that we just listed are kind of the context that we're going to be talking about for the rest of the presentation. So we need to have protocols for our special testing because these are the legal requirements for billing the service. And if we were to ever be audited, these are the elements that they would be looking for in that audit regarding these services that we billed for. So there are 4 steps that we need to meet for a special test. We need to establish a medical diagnosis, we need to document the order, record the data, and then interpret the data and report on that. So we're going to go through each of these steps now. For our medical necessity, we need to have a medical diagnosis or tentative diagnosis from findings in the exam or based on other tests. If we are documenting a disease, it needs to be treatable and it needs to be progressive. So if we were to have a patient who was born with an eye condition that was stable and had, it had been the same forever, then taking a photo of that wouldn't be something that we could bill for because it doesn't meet that requirement of being treatable and progressive. We also can't bill for a service if it's done just to set a baseline with no pathology. So we can't do topography on every patient and bill for it, just in case someone develops keratoconus, because for all of our patients there isn't that pathology currently. And finally, we can't bill for a service if it's performed just to rule out a pathology and there isn't any pathology found in the testing. So once we have our medical necessity, we need to write the order. And we're going to write the order in the plan. And there are 3 components that we need to have in each order. And that is the word order, the name of the procedure, and the medical diagnosis. So, for example, every 6 months we're going to order a spec mic for our keratoconus patients. And so in the plan that would look like order, spec mic, keratoconus. And so that's the least amount of details that we need. We can always write more in that order, but those are the three components that we need to include. Then we need to have documentation of the data, and this can be a printed hard copy that we scan into Revolution, or it can be a digital file. And so the main thing with our digital file is it just needs to be known where we can access that data. So on our spec mic, we only have one spec mic, so if we've ordered that test, we know exactly where that data is. If we were to be using both OCTs for our glaucoma patients for some reason, it would just need to be noted in the chart, where to find that data. And then the data must include the patient's name, the patient's ID, gender, and the date the test was run. So most of these things we're going to hit because every time we make a patient profile in the equipment, it asks for this information. The one thing is our patient ID, including that unique identifier from Revolution consistently into all of our equipment as we run testing. That's our main way that we can improve in this information we need to include with the data. So then finally we need to interpret the data and report on it. And this is separate from just restating the data. So when we type all of our numbers from the test into Revolution, we also need to interpret it. And it needs to be completed within 2 weeks to be considered timely. And there are 7 elements that we need to include in the interpretation and report. So first we need to include the name of the procedure, the date that it was run, a reliability measure, the test findings, and a diagnosis if we're able to make a diagnosis based on this test. We need to report on the way that this will impact our treatment and the prognosis for the patient. And then finally, we need to have the doctor's signature and the date of the doctor's signature included in the interpretation. And if we're writing our interpretation and reports in Revolution, then the doctor's signature and the date of the doctor's signature are just connected with that chart and kind of implied with that chart. So we are already doing a lot of these things that we've talked about today for our special tests. Our discussion today is to just kind of bring clarity to everything that is considered special testing that we do in the office, so that we can be more consistent in hitting all of these steps for all of that testing, so that it's documented really well when we bill for it. And there are just a few ways that we can increase our consistency in our documentation of these charts, of these tests. So for some of the special testing, we have really great boxes in Revolution that kind of prompt us to provide the data and the interpretation. But a few of our tests, we could incorporate that into Revolution. So for Pachymetry, Inflammadry, Adena Plus, Visigraph, serial tonometry, and gonioscopy, our documentation in Revolution doesn't give us great space there to write an interpretation. And so that's one thing that we can modify in Revolution. We can be more consistent in using the patient ID when we are making patient profiles in our equipment for our special tests, just so that we have that one unique identifier that is consistent throughout the office. And then finally, as we develop our standard plans for some of our diagnoses in Revolution, we could add a written order in their plan just to automatically populate for some of our diagnoses where we are repetitively ordering testing, such as our keratoconus patients with our spec mic and topography. So we can have that just incorporated into the plan for just increased consistency there. All right, these are my sources, and that concludes our conversation today about special ophthalmic testing.